So malaria is really a big issue, and it's close to my heart. I can't count the amount of times that I've suffered from malaria. And sometimes you would go to a health clinic, a public health facility, and there would not be medication for malaria. So when you live with a problem for a very long time, like we have grown to live with malaria, it kind of becomes normal. You're seeing people dying. You're suffering yourself. I can't tell you what people go through when you see your child suffering from malaria. The two girls that I told you about, even though we have access to mosquito nets and medication, they have had malaria a couple of times. And as a mother, it pains me to see them suffer. You can't take away that suffering. And it's not a life to learn to live with a problem like this. The malaria vaccine is kind of a relief, to be honest, that there is something that would protect the many vulnerable populations. So young children would be able to, have access to this free vaccine, I would say, or at least affordable in terms of if you look at the cost of having to bring it to this far side of the world. But at least there is a solution to this problem that has troubled us for years, for decades. Um, and therefore to see it, start in my country, in other countries across Africa as well. I can't wait to see a time where it's just everywhere and every child has access to a vaccine. I think from this podcast, people will learn a couple of things. Number one, they will understand how big malaria is and why we should be talking about it. I know that for people that have not experienced it, they would not take this as big news. They would not consider this as something that should be on top of the news to find a solution to. But I think from the podcast, they will be able to understand the extent of the problem and why the world should care um, that we are finding a solution and probably contribute to scaling up this solution. I'm also hoping that personally, I would have contributed to raising awareness about the vaccine itself, the need for more children to access the vaccine. And as someone who has experienced the problem, have lived with the problem, raising girls who have experienced the problem, that many people can also listen to my voice and see the need to play their part.